begin recording as well. So good afternoon and welcome to the Maryland Mentor, Maryland Coalition for Community Schools MOST Network Joint COVID-19 Youth Development Training Series. Today's conversation and topic is all about navigating youth safety and privacy online, a really critical topic and conversation in light of everyone literally transforming their programs overnight into e-mentoring, virtual type programs, etc. So really our objectives, as they were in the past, are really to spark some conversation. And most importantly, during this, again, just really challenging time for all of us, sort of keep this idea and the feeling of community as alive and well as humanly possible. Again, just given the fact that we are socially distant, but hopefully that doesn't mean we are distant in terms of community. So we wanted to just open up with a couple of points before I pass it to my awesome co-moderator for the day. And she's brave enough to show her face as we get started. Let's see here. Okay, there we go. So just wanted to open it up with this quote that I found, which I think again is really indicative of the mindset that I hope we're all approaching this situation from, right? As part of our welcome. And that is this idea that individually we're but a drop, right? We're but a drop in the bucket, or we're but a drop in the ocean, but together we are an ocean. And I just thought this was just a beautiful thought, just in terms of how we sort of see ourselves, how we sort of interpret the connection of it all. Because again, this is a challenge. So just making sure that as much as humanly possible, again, that we're looking at ourselves as part of something larger, something greater. And I think that hopefully helps us just keep that on top of mind, this idea of community. So as we move on, you know, we like to, again, try to keep things as light as possible. It is a Friday, and I know for a fact that at least half of you all on this webinar have worked really hard this week. That was a joke. But we know that you all have worked really hard this week in a variety of capacities, wearing many different hats. We sent out a newsletter this morning, and you know, my message to the field, and you guys can type a number 1 if you saw that newsletter this morning go out. But this idea of duality, we're all wearing all these different hats, and it can be really stressful. But once I get this conversation started, right? What has been your favorite quarantine show, podcast, movie, or book, or what have you so far, right? Folks need some recommendations out here. That's all like my Facebook timeline is full of. It's like, man, I just finished this show that was 9 seasons, right? I finished it in about, 4 days. So what's next? Oh Lord, the Tiger Kings are out. The Tiger King crew is out. Rewatch The Wire twice. Come on, Marcus. Come on, bro. All right, we got a lot of them. War of the Worlds, Good Girls. Where are my chat box folks? Catch these, y'all.
I saw Westworld in there too. I think they are on like the newest, like 4th episode of this season. It's been really good. I've been watching that too.
Westworld is dope. Black Lightning, Ozark. Of course, Ozark is a must. I got to co-sign Ozark.
Everyone's watching shows and movies, but not reading. What's going on?
Oh, hey, that sounds like a challenge, y'all.
Oh, there's Open Book Club. Okay.
That was a great challenge, Sada. Queen Sugar, I've heard a lot about.
Queen Sugar, I just finished that season as well. It's a good show.
Dr. Sleep, that's a great one. Person said he could recite every line of Frozen too. Oh, snap. All right, keep that coming, y'all. Good girls. We got some books on here. We got some more books. Homegoing. I heard Homegoing was really dope. Octavia Butler. Okay. Afrofuturism. Okay. Some good stuff in there. So we're gonna keep it moving, ladies and gentlemen. A ton of really important information to cover. I didn't introduce myself, but this is Sadiq Ali, proud executive director of Maryland Mentor, and I'm joined by my awesome co-moderator today, Ms. Heather May. Heather, you there?
Yes, I'm here. Hey, everybody. My name is Heather May. I'm a project director at the MOST Network. I work primarily on their community school work. And since this picture, I have cut my hair, so I don't know if you guys can tell. Look a little different on the video.
Nice. And to our awesome chat box moderators, Sada and Andy, they'll be making sure that, again, any information and links or resources are seen, checking our grammar and spelling, etc. That's what Sada does. You guys there, Sada, Andy?
Hey everyone, I'm over here screenshotting book titles.
Yep, I'm here too. Hello, everyone. Looking forward to everything we have to share today.
Awesome, awesome. All right, Heather.
Thanks, Sadiq. I will take it away. So this is just a couple of the key takeaways from our last town hall that was on March 27th. I don't know, go ahead and put a 1 in the chat if you guys were there. We are hoping that a lot of you are staying with us. We are doing this town hall series so that we can bring you a lot of youth development updates throughout this period. And so just a couple of the things that we captured from our chat box and from talking to everybody was what was going to go on with summer programming and the 21st century sites, how we were going to bring digital equity and access to all of our students and families across the state, and what are some good ways that we could stay connected, as Sadiq is always talking about. It's really important during this time with our youth, especially those special populations that might need non-traditional supports. How we are keeping everybody mentally and physically healthy during this time of crisis, and then just making sure that we're elevating the most reliable and trustworthy news information.
Awesome.
Thanks, Sadiq. So now we're just going to do just another quick chat box poll. For those of you who were there with us on March 27th, if you just want to share in the chat, what are some of the resources that you thought were really helpful so that we can get all of our new people up to speed. And if you weren't there, and if you have something that you think you'd like to share, this would be a great time to do it. Just go ahead and put it down in the chat. If we see stuff, we'll highlight it here as well. I'm just going to take a look and follow along a little bit. And if Sarah or Andrew want to add something in the chat, go right ahead.
All right. Waiting to see. We're gonna read out some of these URL real time. So again, what was your most valuable takeaway or lesson from our last youth development town hall? Good afternoon, Marcus. Turn your chat, Marcus, to all attendees as well.
Well, I know one of the things that I appreciated a lot from our last town hall, and I was really glad that we were able to bring it back, was getting that COVID update from our health professional. And I know that Dr. Kadira is going to be able, should I say Dr. Huff? I know her as Kadira now, will be able to bring us a lot more updated information too. I'm seeing the Comcast Internet Resources. That was awesome. It's called Internet Essentials. It is this program that Comcast is doing during this crisis, where they are expanding low-cost internet access and also providing some funding for actual technology as well. So like computers and iPads and that sort of thing. So that's a great one. Thanks, Sade.
Awesome, awesome. Does anyone have a resource that's a video of a teacher facilitating a simple lesson online to high schoolers or college students, if that doesn't exist? Great question. Let's see if we can't crowdsource a response to that. Again, does anyone have a resource that's a video of a teacher facilitating a simple lesson online? That's a great question, great resource request. Let's see if, again, we can't crowdsource a response. And we're going to keep pushing.
Awesome, thank you. So here's just an agenda of what we're going to be going over today. We're going to, like I said, have that COVID update. Then we're going to get into some of the meat of today's webinar, if you will. navigating youth and safety, privacy online. We're going to hear from an expert to bring you some of those best practices. And then in our mentor family here, we'll bring you another expert to talk about e-mentoring best practices. Then we're going to do a short group share out where we're going to, again, circle back and find some of these resources that we can put in the chat and then all collect and be able to share out with you guys afterwards. And then we'll do some final announcements from Most and Mentor and a wrap up. So it's going to be a great agenda for you guys.
Nice, nice. Wow, we're getting some responses to those questions as well in the chat box. Amazing. Okay, okay. All right, and just really quickly, if this is your first time tuning in to Maryland Mentor or Most Network or MD4CS webinar or resource or training, just a little bit about us very quickly. So Maryland Mentor's mission is to increase the quality and quantity of mentoring relationships across Maryland and to close the mentoring gap. And essentially we do that via providing a variety of support, such as webinars and trainings like this, trainings, again, technical assistance, resources to the hundreds of different mentoring programs across the state. We're joined by our sister organization, the Most Network, Maryland Out of School Time Network, who has a similar mission, which is all about more and better opportunities for out of school time programming and to advocate, obviously at the state and federal levels, for more resources for programs. And then lastly, MD4CS for short, or the Maryland Coalition for Community Schools, is all about advocating for equity in education through the expansion of the community schools model throughout Maryland. So all of our web addresses are located here in the slides. But of course, if you need any further information about us, feel free to reach out to us. Shout out to all the community school practitioners. Awesome. So without further ado, we're going to jump in to our agenda for today. It's my distinct honor and pleasure to introduce to you all Dr. Kadira Ali Huff, who's a pediatrician with the Children's National Medical Center, all around just an amazing practitioner. She's also a public health professional. That's what the MPH there is, more really, really fancy letters. She's also a Maryland Mentor board member and happens to be my sister as well. So anytime I get an opportunity to work with her on a professional level, besides giving her noogies at family dinners, besides that, it's really, really awesome. Dr. Kadira.
Hi, everybody. Good afternoon. Thank you for having me.
Awesome. We can hear you.
Okay, perfect. So I know that we're all inundated with COVID-19 news right now, but I wanted to highlight just a few key takeaways that I think are really important for us to all be aware of as of April 10th, 2020. So big picture, globally and locally, this novel coronavirus is continuing to spread. And this is in the midst of ever increasing mandated lockdowns that are happening on both the local and state levels here in the United States. One of my favorite resources is the Johns Hopkins Coronavirus Resource Center. And as of yesterday, when I last checked, the US cases were up to about 500,000 of confirmed cases of coronavirus. And I want you all to remember that this number tracks test cases that are confirmed and not those that have gone undiagnosed, just in terms of the limitations of our testing right now. And the same is going to go for the US coronavirus related deaths, which is estimated nationally at about 16,000 people so far. And many experts are underscoring the fact that there are going to be additional attributable deaths that are occurring at home and also in hospital or other healthcare settings that just simply aren't being tested. So they're not going into the pot of COVID-19 related deaths. And just bringing things down to a more local level for those in the DC, Maryland, Virginia area, our local numbers in the DMV are hovering around 12,000 confirmed cases of COVID-19 and about 280 deaths regionally. So that's kind of where we are on a macro level in terms of the spread of this virus that is still in the midst of ongoing community transmission, which I wanted to touch on a little bit in detail next, just because there's been a lot of evolving discussion in terms of how does coronavirus even spread. Up until this point, we've really been focusing on the respiratory droplets, which are these large droplets that pass from person to person, and that's by way of sneezing, coughing, being in close proximity with other folks. However, there's been growing concern about the fact that this can be spread through contaminated surfaces potentially, and that can be anything from stainless steel or plastics. We have found that the virus actually remains viable, which means able to cause infection on these various surfaces from anywhere from 3 days for plastics, 48 hours for stainless steel, and 24 hours for cardboard. And so this has helped us all to be a lot more vigilant in terms of how we are sanitizing our living spaces, our workspaces, what have you, because this is a new expanded area of potential transmission. The last point of transmission that I wanted to highlight today for you all, because again, it's been the subject of a lot of controversy, is this whole idea of aerosolized particles. And essentially, aerosolized particles are much, much smaller in size than what we find for respiratory droplets. So when someone sneezes, you can see that spray sometimes when you're like, ooh, let me take a step back. How those are large. Aerosolized particles are a fraction of the size, and these can be spread through talking, breathing even, and definitely various medical procedures. And so we're starting to focus more on these aerosolized particles because this can be transmitted even from people who don't know they're sick. They can be either pre-symptomatic or prior to exhibiting symptoms. They can still transmit the virus through just breathing and talking in close range. And it can also be spread by people who are asymptomatic. Their symptoms are just so mild, not really detectable, but they can still be unknowingly spreading it to other folks. So of all these different modes of transmission, we still have a fair level of certainty that the respiratory droplets is the main source of transmission and infection. However, the contaminated surfaces, the aerosolized particles, are definitely additional routes of infection. And I just want to mention this in terms of us being vigilant about those other areas. Okay, so the next area I wanted to kind of focus on was the idea of asymptomatic spread. And this relates to the aerosolized particles in part. But there's increasing level of concern about the folks who are in that pre-symptomatic, which is again, before they start exhibiting the cough and the fever and those other more obvious symptoms, the pre-symptomatic and also the asymptomatic, those who have very few symptoms, how they are contributing to community spread. And so there's this kind of silent number of people that are helping to keep the spread going. And so we are really focusing more on the use of masks, and again, really emphasizing the importance of physical distancing, because again, we don't really know who's sick, okay? The guidance on the masks for general public, this has been a change from the CDC, the Centers for Disease Control, about a week ago. There had been a lot of back and forth in terms of should the public wear masks, should they not wear masks, what types of masks, if they are going to wear them. The guidance has been updated. The CDC actually came back to say that they are recommending that the general public wear masks. And when I talk about masks, we're speaking specifically about non-medical grade masks. So not the N95 respirators, not the surgical loop masks. We're talking about the cloth masks that folks can make at home, or patronize an entrepreneur, get a cloth mask. And the purpose of these is to really protect asymptomatic or pre-symptomatic folks from spreading it to other people. So it's kind of creating a little silo for their particles, for their droplets to stay in place instead of spreading into the environment. So it serves a very different purpose than do the N95 respirators, for instance, that medical professionals need to use when they are dealing in close proximity with known or suspected cases of COVID-19, where they actively need to block even very fine particles from entering their airways. So with this new guidance, a lot of local jurisdictions are starting to create policies wherein they're mandating folks wear masks out in public. Because right now, the CDC, it's a strong recommendation, but on a local level, we're getting stronger language to mandate the use of masks. Like if you all have followed, the mayor of DC on Tuesday put out policy to mandate that folks are wearing masks in grocery stores now when they visit, or pharmacies and other retail establishments. And again, this is to help to cut down that asymptomatic spread of the infection. And Montgomery County is the next local jurisdiction that I've seen pass similar legislation, and theirs goes into effect on Monday, saying that when you're out in these public spaces, you really need to have masks on. And then they're also putting additional protections for folks who are working in the grocery stores and these other retail establishments, so everybody can stay as safe as possible. One last thing I want to mention in terms of the use of masks is you really need to still be quite vigilant about hand hygiene, because when you're handling your mask and taking it off, putting it on, that does expose you to contaminating your hands. So that's one thing to keep in mind with wearing masks. The second thing is your physical distance is still going to be your first line of defense. So just because you're wearing the mask doesn't mean that this is your steel gate around yourself. Like, you still need to be physically distant, at least that 6 feet, and even farther away if possible. So these are our additional protections in addition to wearing masks out in public, okay? So the last couple of points I wanted to highlight, just in terms of how our understanding of the impact of the pandemic is having, even beyond a medical impact, is how it's showing up for different communities and differently. So very recently, over the past week or two, states have started to release race-specific data that's really highlighting what we already know. There are very deep disparities that exist along race and class. Just yesterday, Maryland State released some data that revealed 50% of the COVID-19 deaths were African-American, whereas Black folks make up about 30% of the state population. And we're seeing similar trends roll out across the country in terms of racial and ethnic minorities, including the Latinx community, being hit hardest by this pandemic. And that has a number of reasons, which would be a whole nother presentation, but I do want to call attention to that. There's a fantastic article that I was just reading in The Atlantic called "The Pandemic Will Cleave America into Two," which is essentially about the racial and class divides that are inevitably going to get deepened the deeper we get into this pandemic, and even the aftermath of the pandemic. And so just encouraging us to think about, as we interpret the news, just thinking about how our youth and the families that they're growing and living among are being impacted in very different ways. Okay. And relatedly, I just want to close by thinking about some of the other emerging challenges associated with physical distancing that are, again, separate from the very heavy toll that we're all experiencing as a world. From the medical perspective, is thinking about the mental health strain of physical distancing. If there wasn't already pre-existing depression or anxiety, just know that those things can be triggered, worsened, and even new symptoms can emerge in folks who are under this new level of stress. Housing and food insecurity. This is an unparalleled time for everybody in this country, and everybody's grappling. And I know that there have been, some financial supports put into place, but it's going to be insufficient. And so keeping that in mind as we're thinking about how to serve our youth and families. And then as a pediatrician, thinking about children who are already in vulnerable homes, and thinking about having these even tighter quarters and the strain that's putting on families from a child abuse perspective and intimate partner violence perspective. So there are all these additional components of the pandemic, even outside of the medical aspects. So that's what I wanted to leave you all with today in terms of some key highlights and some additional dimensions of the pandemic to keep in mind as youth serving providers.
Dr. Kadira, thank you so much. And I had started reading that article as well in The Atlantic. Heather just put that in the attendee box. Thank you so much for that. We know, again, that this is like COVID-19 update overload, but we're still committed to bringing, again, a brief update, just because the information is changing so rapidly from day to day, week to week. It doesn't make sense to not have a medical professional on here each time we're gathered. We have time for maybe 1 or 2 questions, either via the chat box or the Q&A mechanism. Sada made a great point. Please utilize the Q&A box so that way it doesn't get lost in the chat box. But contact info, yes, we have another slide with her contact info. Again, are there any questions or comments for Dr. Kadira before we let her go? Yes, yes. Kanika just made a great point there in the chat box. Again, last call, questions, comments, feel free to even raise your hand and we can let you speak your question. But again, we only have time for maybe 1 or 2 questions. And if there are none, we're not going to beat you up. And again, there are some resources that we posted the last time that could be found at the Most Network COVID-19 update.
So I see one question just came in asking about prevention methods. So our #1 preventive tool still is to stay at home as much as possible. And for a number of different reasons, I understand that's not possible for everyone, but for those for whom that is possible, that's prevention tool #1. #2 is wearing masks when you're out in public. And again, this is a protection for everybody. And mostly the cloth masks that have been recommended for the general public are to prevent, assuming that you are infected and that you could potentially be a part of transmitting it to other people. Okay, so if everybody's wearing masks, then everybody's particles and droplets will be siloed close to themselves and they're not going to spread it into the general airspace. And then the next thing is really, really excellent hand hygiene, because even when we're thinking about the different surfaces potentially being a route of infection, if you're washing your hands before touching your face, before putting in anything into your mouth, then that's going to be that kind of final layer of protection, even if you are in contact with the surface that's contaminated. So physical distancing, wearing masks when out in public as a universal precaution, and then excellent hand hygiene. Those are still going to be our best prevention methods.
We did get a question in the question and answer section from Kendrick. What about chain letters that are going around apple cider vinegar, hot water, steam as suggestion?
Yes, unfortunately, there's no data to support those as means to cure or prevent infection. So again, I would go back to, re-refer to those reliable sources in terms of the CDC and other health outlets. But for now, hand hygiene, staying away from folks who are infected, making sure you're meticulous in terms of cleaning your surfaces with a high concentration alcohol solution or household bleach. And wearing masks when in public. Those are going to be your sure bet ways to prevent it.
We got one more question, Kadira, from Kathy Benson. Hi, Kathy, by the way. Why can't we institute rapid testing for staff at nursing homes?
Yeah, that's a great question. And the same question could be asked of even some healthcare centers, like major healthcare centers that don't have sufficient testing. There's a lot of supply chain issues, and that are, as quickly as possible, we're trying to play catch up as a healthcare system, but really it's supply and demand, and we just don't have enough supply. And there are a lot of different steps in terms of getting testing agents completed. And so there are many steps in that supply chain that are just slow, and we're trying to play catch up. And that's because of a lot of systems reasons. But I think that's where we're going, not just in terms of the traditional testing that we're doing right now, but even thinking about antibody testing and how can we know for sure who's been infected and will they have immunity. So there are a lot of different nuances here with testing, but everybody's working on it, just playing catch up.
See, like, people were shy at first. Now the questions are pouring in. Let's see if we can knock these ones out quickly. Outside of Johns Hopkins, what are some other sites we can keep up to date?
Yeah, so the Hopkins one I like a lot. Your various newspaper outlets tend to have really good sections. One of my personal favorites is Dr. Peter Attia. He is fantastic. He's a researcher, and he has very comprehensive updates on coronavirus and its spread and ways of prevention, Peter Attia. And then also I would recommend The CDC has some good basic information. I know that there have been some issues in terms of information dissemination, but they still do have a good amount of relatively reliable information too. And what if, so it looks like there's one more question. What if consumers get sick and are turned away for healthcare? What are some things they can do at home to get better? So this is a tricky question just in terms of how mild are their symptoms versus how severe. So big picture, I recommend if you are suspicious of having COVID-19, call your healthcare provider when possible instead of showing up to the clinic or showing up to the emergency room, unless your symptoms are so severe that you need urgent medical attention. The good news is that even for the majority of folks are going to have mild to moderate disease, which can be handled at home. There's that slim minority who get sick enough where they urgently need medical attention, but for those who are at home, it's really going to be managing your fever, trying to stay hydrated, keeping tabs on your breathing. And if any of those things become unmanageable at home, that's when it's time to get in to seek medical care, especially when there's shortness of breath, difficulty breathing, and concerns about dehydration. So sometimes if you do call, they do triage you to get a sense in terms of where you are in that disease spectrum. And if you're on the milder side, they are going to encourage you to stay home and try to manage your best with those kind of supportive care measures. Okay.
We got one more question in the question and answer box, if that's okay. That is from Ethan Thompson.
The last one. We gotta move on in the agenda, unfortunately. But please type those questions in. Type those questions in the chat box. Andy, you want to read that last one?
Can do. So what is the best way to approach providing guidance to those communities that are facing these disparities with testing and healthcare? Best prevention, or are there any advocacy groups yet?
You know, I haven't heard of any coronavirus specific advocacy groups, but the big thing right now from like a social welfare perspective is getting plugged into a lot of the city specific and statewide specific relief to ensure folks have food, that housing is secure for the time being. And in terms of the healthcare advocacy piece, I think that's going to be a long game. And again, I haven't seen any coronavirus specific advocacy groups, but big picture, I know that this is going to reveal the need for even better advocacy for just health disparities in general, but nothing that I've seen specific to this at this point in time. The best advice right now is to try to mitigate transmission as much as we can by staying home and doing the other things I already discussed.
Thank you again, Dr. Kadira. Let's please give her a virtual hand. Just like, we've been doing the number 2 thing. Type a number 2 if you appreciated those comments, right? Or if you got your emojis on your phone, you know what I mean? You got a lot of number 2s in there. Thank you so much, Dr. Kadira. We're gonna move on to our next presenter. You got a quadruple 2 there. Nice job, Dr. Kadira. Thank you so much. Follow Dr. Kadira on Instagram that's at Kadira Huff MD. That's medical doctor for all you people out there. Thank you so much.
Okay, so next up, we are going to hear from Mr. Reginald Corbett, who is the founder of Safe Cyber, whose mission is to educate and promote cyber awareness to schools, community organizations, parents, and caretakers of youth. And he travels state to state raising awareness about cyber safety topics such as cyberbullying, dangers of social media apps, online predators of children, and digital footprint and reputation. So we're really happy to have him here today to be able to speak to us about what you and your family can do to keep our youth safe while they are more and more going to be online during this time. So I'm just going to turn it right over to you.
Good afternoon, everyone. Thank you for having me. I appreciate it. So I want to basically talk about you as mentors, and I know we probably have quite a bit of parents online here on today who probably have children like me at home. So if you hear a child or two in the background screaming or something of that nature, please look over that. That's the way of life nowadays for most of us. the number one thing that I think we should recognize and understand, it's like Sadiq spoke and said that times have changed, and literally times have changed for some overnight and some the past couple of weeks. I used to say that we're living in a digital age, but definitely living in a digital age now. We're definitely more engaged in the digital age. The way we live and do business has changed for most of us. Like I said, parents are working from home with children, and those children are being schooled online right next to the parents. The restaurants that we used to sit and enjoy are now bringing our food out to our car because we ordered it online. So we're here, and I doubt that we'll go back to what we knew as normal. So as parents and mentors who deal with youth, we've had to shift how we interact and, influence and frankly raise our children. So not only are we trying to raise good citizens, we are trying to raise good digital citizens. And so that's what I want to talk about and share on today. The digital world, as you know, is a real world. Youth are having real conversations, dealing with real issues, and facing real threats and dangers online. And for instance, for an example, you have applications that will allow for youth to meet anybody, anywhere in the world. And so they're engaging and having these conversations with people that they may not know or may not even meet in person ever. But there are attempts from the other end for, let's say, adults or people to try to meet our youth online. And sometimes the youth are open to that. But what I want for people to understand, and what I try to get people to understand, is that the digital platform, the landscape is no different than, let's say, our regular landscape. Again, for those who have children, you want to think about when you first let your child out to play, you don't usually let them out to play in that landscape by themselves. You don't say, open the door and say, there you go, have fun, figure it out. For the most part, most of us will allow our children to go outside, and we'll go out with them, and we'll talk to them about the boundaries and, how you can't go outside the gate, and how, don't touch that yet, don't touch this yet. And so we talk to them about those boundaries, and we set those boundaries. And as they get older and as they get more mature and as they become more responsible, then we'll allow them out the gate. Then we'll allow them to ride their bike up and down the street. Then we'll allow them to ride their bike to their friend's house and things of that nature. So that's the way we should picture the digital landscape as well. In some cases, because we have a generation of adults who have not grown up in the digital age, they aren't really thinking from that perspective. We definitely have a generation of youth that will not know what it means to be without technology because of the digital age and how it has transitioned over time. So there is sort of a barrier at times when it comes to adults trying to monitor and manage that. But that's what education is about, right? Education is about, information, will change situations. And so it's important for adults and mentees to be, and mentors to be informed about what's going on in the digital age when it comes to technology in today's youth. So one of the things I want to mention is having the tech talk. In my opinion, there's a few talks. There's a sex talk, and then there's the tech talk. The tech talk. The tech talk is about talking to youth about those boundaries, talking to youth about what's going on in the digital age, and having that conversation and educating them that, it's not about just fun and games. You have people who are trying to reach out and contact you in ways to solicit you for things, in ways to try to meet up with you outside of the digital world. For instance, when it comes to the gaming, the gaming industry, the gaming world is a really, really big world. We probably have some parents on here who have children that are involved in the gaming world pretty heavily, and especially nowadays because they are at home, there's going to be more engagement. There's going to be more engagement on digital platforms all around, whether it's social media, Instagram. TikTok, as we know, is pretty popular nowadays. And so talking to parents, talking to children about, you know, the possibility that someone may try to engage with them or groom them. Online grooming is basically a predator that is reaching out to youth and forming a relationship with them. And as we know, with most relationships, how they happen is by spending time with someone. And so that's the same way when it comes to being on the digital platforms and comes with technology. The more children spend time with people online, whether that's gaming or whether that's on social media platforms, whether that's video chatting or something of that nature, the more they're going to form a relationship with them. And so as parents and as mentors, one of our biggest challenges is to be the bigger influence in today's time, especially when it comes to the digital world. And that's pretty hard because they're constantly engaged. They constantly have devices that they are using on a regular basis. For the most part, most youth do have devices in some way, shape, or form that they're using, whether it's a phone, a tablet, or a computer. You know, now they're giving out laptops to children that need them for school. And so, you know, we have to talk to them about, you know, those times when they are considered bored, how they will start investigating and how they will start searching and looking for things and looking for ways to entertain themselves. And so it's very important to have that conversation with youth because this is sort of cliche, but I'll say it, it's not a matter of when or a matter of if they'll come across something that they probably shouldn't see or hear, but it's a matter of when. And so eventually it will happen as long as technology has access to them, the internet has access to them. I'm sorry, as long as they have access to the internet has access to them. And so it's important to have those conversations with them. And so you, as a parent and as a mentor, you want to check in on their online life on a regular basis. Again, they're having conversations. They're talking and chat with friends online more than ever now. So checking in with them just as you would if you were checking in them on face to face, you know, checking in with them about schooling and things of that nature. So you want to ask them what's going on. You want to ask them, hey, what are your friends doing online? Sometimes the kids won't tell you what they're doing, but they'll tell you what their friends are doing online. So asking them about that, about their friends, sometimes that will lead to doors and conversations that will open up and they will tell you about, you know, what's going on in their life. Because in some cases, kids are facing some really, really major mental heavy things online, you know, because they are connected online on a regular basis. Whether it's the gaming, you know, too much screen time, that's a big issue nowadays. We have organizations that are talking about that, to things like sextortion. And basically, sextortion is, let's say a child meets an adult online or meet a person online. They may not even know that they're an adult. They'll meet this person online, and this person will talk them into, because of the online grooming, they'll talk them into sending, let's say, an inappropriate picture. And that youth would be like, I shouldn't have done that. I won't ever do that again. But that person will reach out to them again and say, hey, you send me one picture, you should send me more. And then you says, no, I don't want to do that. And then that person says, well, if you don't, I'm going to put this out on, you know, these platforms. You know, I'm going to put it on social media. And so that's basically sextortion. And some children will deal with that on a regular basis inside the comfort of their home, and parents won't have any idea. They won't know that that's happening. There will be some signs of it because it'll affect their relationship with their child. And you as mentors, it's the same for you because you deal with youth on a regular basis. So sextortion may affect your relationship you have with your mentee because they won't tell you about it. They're so frustrated, they're stressed about it. They don't want to tell someone because they don't want their phone taken away from them. They're embarrassed by it. And so that's something that could possibly be happening. I tell parents all the time, just because your child is in your home and you can see them does not mean that they're safe when it comes to technology. this could be happening and they could be sitting right next to you. So having that conversation with them about what's going on in their online life is really important. And so you want to teach conflict resolution skills because, again, children are online these days, and I don't think that it's slightly different when it comes to conflict and the bullying and some of the beefing that's going on online. But there's probably a slight uptick in it because now we have this platform. We can't express ourselves to people face to face, so we're going to go to these platforms, and then we're going to start, expressing ourselves and talking about, other people and how angry we are and how upset we are with things in life and things of that nature. And so there may be this back and forth between youth and students or whatever it may be, because technology allows these platforms allow for people to not be known who's on the other side of that device. And so you have people who really just kind of sit around all day, and that's what they do is troll and cyberbully online on a regular basis. And so talking to them about conflict resolution skills when it comes to technology and how important that is something that needs to be discussed as well. And so also you all want to stay informed, just as you are right now. And again, because everything is moving so fast, super fast now than it has before in the past when it comes to technology. You want to stay informed about what's going on, the type of platforms that are out there. I'll say this because people ask me all the time, and because there are platforms that, social media platforms specifically, that pop up all the time. The basic point of them all is to socially connect. And so that means there'll be, texting that's involved with them. You can message now via YouTube, so things of that nature. It's all about communicating with other people. So most of these platforms, they may have a different name to them, but the concept and the need and the purpose of them are pretty much the same. It's to be social, and socially connected and digitally connected socially. And so it's very important that that there's communication that could take place on these platforms, like I mentioned about the gaming that happens on a regular basis. And so as parents and you as mentors, the next thing you want to do, you want to make sure that you enforce your core values and morals. I know you as mentors, you teach the youth about values and morals on a regular basis. And so your hope is that the way that they interact in person, which we hope is great, is the way that they'll act online as well. Sometimes it's not the case because, again, people can hide behind the keyboards, people can hide behind the devices, and so sometimes people use it as a way to create these other people, whether they want to vent or whether they just consider it to be fun or have fun, aka catfish at times, is what we call it in some instances. But understand that our goal is to teach our children to have those same core values and morals when they're online, because for you all, it's important to emphasize to the youth that now more than ever, their digital footprint is important. Everything that they put out there, every platform that they're on, the way that they communicate, every picture that they send, there's no such thing as erasing. And so everything that they put out there, it can be recorded, tracked, it can be recalled. So it's important that you talk to them about the digital footprint and reputation, and what that means for them is that everything that you do, definitely from here on out, is being recorded, and it can be used against you later on. As we know, companies now look at social media before they even call you in for an interview. They look at your social media to see if they can kind of get this picture of you. And so they'll go back as far as they can, as far as they will allow them to go back. So talking to them about their digital footprint and what they can do right now in this time to correct it if it is wrong, If it isn't, to continue to put out content that that represents them, in a good way, that represents their core values and morals, and represents what you as mentors have taught them in the past as well. So that is pretty much the gist of it. I wasn't keeping time, but I think some of you were. Yeah, so we talked about, are your parent working from home? Screen time will be one of the many ways you occupy your children's time. Occupy your children during this time while you attend those virtual and telephone meetings. Keep in mind that they're using the same network that you are. If they're not being safe, their actions could impact your company's security. So let's talk about that for a sec. So how many of you pay attention to when we download apps and that box comes up and says they need permission for your address, your picture, your blood type, all of that nature? How many of you really pay attention to that? You just click that button and you download that app. I guarantee you most people who downloaded TikTok didn't pay attention to that. Some of these other apps that are out there. And so now that we're at home and we're working from home, we're working for these organizations. Some of these organizations have 3 letters. And so it's very important that that you as a remote worker and your family know that it's very important that your security at home, your digital security at home, comes into play on a regular basis, and that you know and understand that anything that you download on your home's network could jeopardize your security. And so talking to them about downloading apps and things on their computers and on their phones is very important as well. And you want to make sure that you set your security settings. You want to make sure that you have a VPN, a virtual private network, if possible. And you want to make sure when it comes to your child's device, most phone companies now have a parental feature that will allow you to be alerted if something is downloaded on your network, on your device, on your child's device. So that's something that you want to make sure that is in play when it comes to your children downloading things on their devices and on your network at home. So I think I will stop right there. And if anyone has any questions, we can move forward with that, if that's okay with you, Sadiq.
Perfect. That was an awesome, just review and a couple of key things for us to think about. That was really, really helpful. I think we already have one question. Sada or Andy?
Yes, we have a question from Konika. What are some other privacy settings we can set for the electronic devices?
Well, it depends on the device. And I'll say this, that's something that I hold workshops on. I'll have parents bring in their devices, whether it's Android or iPhone, and we would go through that. But it really depends on the device. But the number one thing is to make sure that your security is up to date. Your security software, make sure that's up to date on your phone, on your network. And please, and I'll say the other number one thing advice I give is to please make sure that you change your passwords to something difficult. Do not leave it as admin123. Most people don't change that. If you may name it your dog, please don't do that either. You try to get as complicated with it as possible when it comes to your password. Don't use your children's name, birth certificate, middle name, nickname, or anything like that, unless you're doing maybe yours and a couple of birthdays and things of that nature. But you really have to get complicated when it comes to the passwords. But the other thing I want to say to that, to answer your question, is that depending on your device, most companies now, you can go to their website and it will let you know exactly what features they have. Definitely the phone companies, they are now joining in on the fight to help protect our children online. Most of them have features that will allow you to monitor and deactivate the Wi-Fi to your child's device. One thing I encourage parents to do is to not allow your children to take those devices to their bedrooms at night. those are the times where the conversations are being had. If you're my age, you remember we used to hop on the phone at night and sneak on the phone on the regular phone at night. And our parents would get on the phone and be like, you better get off this phone. You know, it's past 10 o'clock. You got school tomorrow. We no longer have that luxury because most homes don't have phones or hard lines, shall we say. We have digital devices. We have cell phones. So I encourage parents not to allow children to take those devices into their bedrooms at night. A few years back, I'll give you a quick example. A few years back, a young lady here in the area, she met a Virginia Tech college student online on one of the apps, and they engaged in a relationship for quite some time. And he would encourage her to sneak out of her window at night. Well, the last time that happened, she never returned because he allegedly took her life because she was 13 and he was 18, and he felt that she was going to tell someone about their relationship. But because she was able to take that device into her room, that helped play a role in ultimately something happening to her. So again, I encourage parents to not allow their children to take those devices into the bedroom at night.
Thank you, Reginald, for this great advice. We got 2 more questions here. I'm not sure how many more we want to do in the interest of making this a 90-minute webinar. That's up to presenters, but here they are. One from Jennifer McKenzie. What is your take on security concerns around Zoom? Is it safe to use for mentors and youth development practitioners who are meeting remotely?
Let's tie that into this other one real quick, Reginald, before you answer that. And then from Simone in the chat box, how do we protect youth if we're hosting webinars or sessions on Zoom or Google Hangouts? Are there best practices we should be following, which we're going to talk a little bit about in the next section. But Reg, if you can address both of those, that would be good.
Yeah, so because we moved so quickly in the past couple of weeks, Zoom was not ready for everybody to start using their platform. So I'll try to answer the question in a couple of ways. Really, at this point, there aren't really many options that are more secure than Zoom or Google Hangouts. I know that they are constantly updating as they learn of loopholes and security issues on a regular basis. They're constantly updating their platforms, and that's really all they can do is continue to update their platforms on a regular basis. I know they have increased their cybersecurity teams because people are finding these loopholes and because they are being hacked. And sometimes they're being hacked and we'll never know about it. Sometimes they won't announce it, because of the fact that they don't want people to stop using their platform. So the security threats happen on a regular basis. It could possibly be one now as we are here and talking. So the answer is that's probably, those 2 platforms are probably the safest for what people are doing nowadays when it comes to online meetings. As far as protecting youth, on the backside of that is making sure that these homes that are the children are in and conducting their Zoom meetings on the other side, making sure that you're giving them the information that I'm giving you. Make sure that your networks are secure as much as possible, and make sure the kids aren't downloading just anything and everything, even the parents as well, onto their devices and on these computers.
Awesome. Thank you so much, Reginald. Let's move this slide here. So your contact info.
Yes, sir. That's it. Feel free to reach out to me. I have some information on the website, which is safecyberedu.com. Definitely going to keep updating and put more info up on the website. Click the resources page. There's information here that I talked about. That's on there as well, on my resources page as well. So, and feel free to reach out to me for any questions.
Awesome. Thank you so much. Again, let's give him a digital round of applause. Type some 2s if that was helpful. Type some 2s. Right. Make sure everybody, again, you have your chat box setting to all attendees. Let's keep pushing. So for the next several minutes, which is going to take us pretty close to conclusion, I'm excited to introduce to you all Dr. Lysandra Jaquay Bridges, who is a Maryland Mentor technical assistance consultant who has many years in the mentoring field, has created a number of mentoring programs across the country, is what was a major leader and program practitioner for the National Mentoring Program of Concerned Black Men. Just an all around, just amazing, again, practitioner and just mentoring best practices expert. He's actually gonna walk us through a pretty brief overview of e-mentoring best practices, which I think we'll get to some of the other questions that were asked a little while ago. Dr. Bridges, are you there?
Yes, I'm here. Can you hear me?
Yes, sir, we can hear you. So please just tell me when to advance the slide.
Okay.
Show is yours, floor is yours.
All right. All right. Well, like you said, my name is Dr. Bridges, and I'm a consultant for Maryland Mentor. And today I will be providing you with a synopsis of the EEMP supplement. And the supplement manual provides some key insights for e-mentoring programs. So in some of the, and I'm pretty sure mine is probably the longest out of all the panelists here, because to be a synopsis, this is definitely an understatement for how long this manual is. But however, we're going to do our best to get through it. So for the purpose of this resource, we're defining e-mentoring programs as those where mentor-mentee interactions primarily or exclusively take place using technology. E-mentoring can be referred to in a lot of different ways. For example, some programs are referred to as electronic mentoring, digital mentoring, online mentoring, virtual, or computer-assisted mentoring. More importantly, any program that includes the type of mentoring that incorporates digital technology. E-mentoring programs that allow mentors and mentees to interact primarily through technology. E-mentoring program participants use a variety of technological platforms to communicate. So some examples of those are emails, bulletin boards, forums, chat features, or other text-based communication methods. Some use of video conferencing platforms like your Facebook, your Hangout, while others offer a software system that combines many of these features. Interactions can be synchronous with the use of video calls and chat programs, or asynchronous, which includes emails or text. And some programs may have a combination of both. You go to the next slide. While the literature on e-mentoring is growing rapidly, there is an insufficient number of well-designed experimental studies of technology-driven mentoring on youth outcomes. With the rapid pace of technology development, the platform used in e-mentoring can quickly become outdated. So for an example, listservs, while still used by some professionals, have been largely replaced by platforms. In regard to the literature review conducted, a variety of strategies were used amongst programs. Among the most common theoretical framework used in e-mentoring consists of offsetting youth isolation and increasing the feelings of belong and connected youth with communication challenges that made in-person interactions difficult, and providing access to high-level subject matter expertise and project goal setting support. While little research exists in terms of the impact of e-mentoring relationships, some recurring themes were highlighted in this manual. So we had demographics. Some youth, such as those in rural locations or a low socioeconomic status, may benefit from e-mentoring more than youth who do not have the access to transportation or more stable family settings. Another theme is personal factors. Both mentors and mentees' personal circumstances can influence the effectiveness of e-mentoring programs. For instance, a mentor who is not as technology literate or savvy as a young person may find using technology to communicate challenging and limiting. Interpersonal communication styles, a mentor who is used to talking by phone or in person may struggle with the quick text, the emojis, the acronyms commonly used in chats. It is not their usual form of communication. On the mentee side, emotional maturity may be important, as being able to share emotions in writing without the facial and body language cues available during in-person meetings is crucial. And then we have accessibility. E-mentoring is potentially more accessible for youth with physical, intellectual, and developmental disabilities or chronic health conditions, since it does not necessarily require that the mentoring and the interaction happen at a specific location. Program implementation, access to stable mobile network or internet service is essential for the success of e-mentoring programs, as easy access to technological support. So one factor is relationship satisfaction and conversational capabilities. Some mentoring programs focus on relationships that are intended to be emotionally close and meaningful, while others focus on relationships that are task focused and more instrumental in nature. One of the leading factors in relationship closeness was what one researcher termed electronic chemistry, the ability of mentors and youth to connect electronically in a way that were mutually satisfying, fun, and with personalities in spite of the limitations of communication digitally. Frequency of interaction was also a factor. It comes as no surprise that for mentoring to be effective, participants in the relationship must be well participating. I also want to note this significant finding. Several scholars noted that the frequency of communication in e-mentoring programs almost always dissipate over time. Electronic chemistry may be a contributing factor as to why there is a reduction of frequency over time. Next slide. Next slide. Okay, there we go. Yeah. So the supplement EEP also mirrors the original EEP 4th edition, but offers some additional addendums that specifically focus on e-mentoring programs. Here I will address the first standard for each section in the EEP supplement. For each standard, there are a variety of benchmarks and extensions. So for number one, standard number one, recruitment, recruit appropriate mentors, mentees by realistically describing the program's aim and expected outcomes. Standard two, screening, screening prospective mentors to determine whether they have the time, commitment, and personal qualities to be a safe and effective mentor, and screen protective mentees and their parents and guardians about whether they have the time and commitment and desire to be effectively mentored. Standard three, training, train prospective mentors and mentees and parents, legal guardians, or responsible adults in the basic knowledge, attitudes, and skills needed to build an effective and a safe mentoring relationship, usually culturally appropriate language tools. Standard four, matching and initiating, match mentors and mentees and initiate the mentoring relationship using strategies like to increase the odds that mentoring relationships will endure and be effective. Standard five, monitoring and support, monitoring mentoring relationship milestones and child safety, and support matches through providing ongoing advices, providing solving training and access to resources for the duration of each relationship. Standard six, closure, facilitate bringing the match to closure in a way that affirms the contribution of the mentor and the mentee and offer them the opportunity to prepare the closure and access access the experience. Next slide. So there are both advantages and disadvantages to developing and deploying a custom software platform compared to the use of a generic software that is not customized or developed by the mentoring program. The 10 themes associated with customizing and developing software are ease of access, cost, curriculum, recruitment, screening, monitoring, support, building social capital, evaluation, and privacy. All these themes have pros and cons. At the end of this presentation, if someone has some specific questions about the advantages and disadvantages, I'll be able to provide more detail. In reference to the issues regarding hardware device selection, programs need to choose whether mentees can access the software on any hardware. If the software platform is only installed on a computer in school, then it is only accessible during the school day, which limits when mentees can access their mentor. Furthermore, there are also advantages and disadvantages associated with supplying versus not supplying hardware devices for program participants. For example, There's a large digital equity gap in the ownership of computers, tablets, and smartphones, with children in low-income homes being significantly less likely to have access to hardware devices in their home compared to wealthier peers. Next slide. The first and most important issue is that the technology must align with the mentoring program's theory of change and the requirements of the program. What program participants are expected to do together through the e-mentoring program will contribute to the decision about what technology is needed. For example, if the program requires participants to complete activities together, this will likely require mentors and mentees to see one another via video or virtual world to fully participate. Secondly, the desired outcomes of the program will also impact the selection of technology that's suited to the program. For example, if the e-mentoring program have goals of improving mentees' reading and writing skills, in this case, text-based technology may be most beneficial for program participants. Programs working with mentees from more vulnerable groups, such as victims of sex trafficking, youth with chronic illness or serious disabilities, very young mentees, may also determine a closed system is necessary, given the vulnerability of these groups to negative influences. And then D, overall, these platforms may be particularly important for e-mentoring programs that aim to have participants improve non-verbal skills, or programs that concern the absence of such cues would impact program effectiveness. Next slide. So the I Could Be e-mentoring program is a research-backed curriculum that takes mentees and mentors on a shared journey through online activities and relationship-building conversation areas. Match mentees and mentors participate in asynchronous conversations that allow busy mentors to participate from any location at any time, significantly growing mentor recruitment pools and increasing mentee-mentor engagement. After matched mentees and mentors respond to one another, automated emails and text messages are sent prompting participants to log in and reply at their earliest convenience. And what I really like about this online program is that the program ensures the safety of the participants' conversation through an advanced filtering system, constantly operating in the background as mentees and mentors share information and respond to activities. Filters created and updated by I Could Be block and flag personally identified information, inappropriate content, and any content that may be indications of danger to the mentee. And all filters are reviewed by the program staff daily. Next slide. The required speed and frequency of interaction between program participants can also inform the selection of technology. If the theory of change includes providing mentees with efficiency, real-time support, then the technology should also allow mentors to receive communication from their mentee as easily as possible, such as through text messages, emails, push notifications on their cell phone. For example, mentees may send an urgent question to their mentor regarding how to handle a specific situation and expect to receive a quick response. Other mentoring programs may not expect or have the real-time capability. Another major consideration when selecting technologies for e-mentoring programs is the characteristics of the program participants, such as their ability to access technology literacy. So the demand of program and challenges with using technology employed needs to align with the ability of the program participants. For mentoring programs that include mentees with low literacy skills, technology that utilizes video may be preferred methods of communication to help reduce the impact of these skills on abilities of the mentee to participate. E-mentoring programs that work in close partnership with schools or other organizations must consider the potential integration of software systems when selecting a technology platform, as well as the policies and procedures of any partner organization. To ensure technology will meet all necessary requirements, integrating a mentoring software platform into a school setting may have additional requirements due to FERPA and school policies regarding the internet use by students, as well as challenging navigating the school's firewall and other security software. Laws, statutes, and government policies are relevant, significant to e-mentoring programs because of the rise in security breaches, hacking attempts, virus, phishing, spyware, and other technology security risks. Both US and international governments have taken notice and created laws and regulations regarding the use of data. Furthermore, with the proliferation of computers and other technology, laws, regulations have also been written to make software accessible to users with disabilities. There are several laws and statutes covered in the EEP supplement. If there are any specific questions about the laws, I can answer those questions as well at the end. E-mentoring programs should be familiar with the various technology accessibility laws and guidelines when selecting technology for their program. Funding sources and the population served by the program will primarily determine what accessibility laws and guidelines are relevant to the e-mentoring program. However, it is important to be aware of these guidelines and determine if they are relevant to the program participants.
And Dr. Bridget, if I can jump in really quickly, I want to be able to save some time to get to a couple of questions. We're running short on time. I want to make sure we're able to let folks go right at 3:30. I do want to just turn folks' attention to the fact that everything that Dr. Bridges, right, is referring to can be downloaded via the e-mentoring best practices, right? As he noted, these are a supplement to the elements of effective practice for mentoring, which are, the national research and evidence-based best practices for mentoring. So I just wanted to call attention to that. But again, we will send out these slides, but I just want to make sure that we have enough time to wrap up and still get a couple of questions in, because I think a couple have already started pouring in. If that's okay with you, Dr. Bridges.
Yeah, no, not a problem, because I know definitely want to be courteous for the time's sake. And this is definitely, like I said, a lot of information here to cover, but that last part was definitely important, and it kind of feeds into what the last participant was talking about, the panelist was talking about, especially when it refers to the security and the privacy on these e-mentoring programs as it relates to e-mentoring programs.
That's right, that's right. And I would just call attention, while again, if anybody has any questions, please type them in the QA box. But we wanted to let you all know that in conjunction with the National Mentoring Partnership, AKA Mentor National, they have actually worked with the same organization that Dr. Bridges just mentioned, I Could Be, and they are offering programs that were traditionally in-person brick and mortar programs, but I Could Be is actually offering free access to their mentoring portal for the next couple of months. And you can find out more information at that URL, mentoring.org/virtual mentoring portal, which again has many of those exact same benefits and really just safety features built in that Dr. Bridges just mentioned a couple of slides ago.
All right, little update, no questions so far.
Okay, okay. Again, I know we folks are raring to go. It is Friday. I know y'all ain't in a rush to go nowhere, but I'm just joking. But this is Dr. Bridges' contact information. As we mentioned, Dr. Bridges is also one of our technical assistance consultants, meaning that you can click on this link and actually work with Dr. Bridges or one of our other consultants like Jeanette Simon, who's in the webinar with us today, at no cost to your organization to even work with you around implementing some of the best practices generally for mentoring programs, or as well as specifically around transitioning your program, as this conversion has been pretty trying for all of us, to more of an e-mentoring type program, because again, there are many, many additional considerations that Dr. Bridges didn't get to, but that is critically, critically important. So is Simone saying that she put a question in there? Okay, no questions right now. So we're gonna keep rolling just for the sake of time. We're moving towards conclusion. Thank you again, Dr. Bridges. Let's give it up for Dr. Bridges as well.
Just got more of a comment than a question, but it says Zoom also has backgrounds from Jennifer.
Right, because someone asked about how to, no, that was a great question, Jennifer. Someone asked earlier about almost like, what does it look like to provide support to a young person that doesn't want to turn their camera on for, for anxiety around what folks might see in their home and their background. So that Jen was actually just talking about how Zoom, I'm not sure about some of the other platforms, actually provides for a feature such as this, right? So if I share my video, you guys can see that there's actually a little kooky little background in the back, which I think, again, some of the additional platforms have a similar feature. So hi, everybody. Let's keep rolling. I'll even keep my screen up for the rest of the time. So we wanted to just do a little bit of a group share out, but again, we've run short on time. Renee said Google Hangouts also has free closed captioning. But are there any additional resources? We wanted you all to be able to drop those in the chat box. If there are any additional resources that you or your program are using that we could potentially leverage, that would be awesome. And also just looking at these questions, right? How are you and your program dealing with privacy and safety concerns online currently? What resources are you using to keep tabs on safety? How is your team handling concerns? And currently, do you have a written safety policy, in regards to online, et cetera? And just looking for folks to share out as many of those examples as possible. I think that's one of my kids in the background screaming as well, which is awesome.
And also, guys, if you have any upcoming events or webinars that you think might be helpful to our youth practitioners and mentors, please just let us know, put those in the chat. We'd love to be able to share those out as well.
All right, so we have a couple of final announcements before we're out of here at 3:30. That was an excellent one. Recording all sessions and typically a staff members on every call. That was a great one. These are some additional national online safety resources, some local, some national online safety resources. So again, we will be sending this slide deck out. If not by the end of today, definitely first thing on Monday. But these are some of those additional tools. That's a good one. Bree said that they're removing last names and any additional identifying information from anything that they share with the public, which is an excellent tip. Coming up, so next week, we were actually going along every 2 weeks, but next week's conversation is so important. We've gotten a ton of questions around how can nonprofits access more of the resources, right? Either federal grants, state grants. It was literally just announced about 24 hours ago that there is a brand new COVID-19 funding collaborative out of Baltimore and for the greater Baltimore area in terms of the surrounding 3 or 4 counties. We'll be discussing all of that and more on next week's How to Apply for COVID Grants and Funding training series. So we hope you all can join us for that. And then the following week on Friday, April the 24th, we'll be talking all about additional creative virtual youth engagement ideas. So we'll be hearing from 5 different organizations here in Maryland, and they'll each be sharing 5 different tips and strategies, et cetera, that have been working well for them, since the self-quarantining and isolation has started a couple of weeks now. I guess we're going into week number 4 now, if we can believe it. A couple of upcoming webinars from the Maryland Mentor side, and I'll pass it to Heather to wrap us up. But leading a quality mentoring program with best practices, understanding youth development principles. All of these are webinars and will be hosted virtually. In May, we're going to be talking about creating a diversified funding strategy, especially what does fundraising look like in the age of COVID. Keeping in mind, we don't know how long this is going to be going on, but we'll be discussing that, as well as hosting a virtual forum on mentoring youth impacted by the opioid crisis. That's one thing that we haven't chatted about a lot today, and that is we know self-medication and substance abuse and misuse is going up all across the country during this time. And that's not just amongst adults, but also amongst young people. So we also intend to address that during our virtual forum. And then lastly, in June, best practices for training mentors. Heather, if you want to touch on Cypherworks.
Yeah, absolutely. Cypherworks is a professional development program that MOST has developed with the Cypherworks organization. It is a great price, especially right now during this COVID stuff. It has the classes on there have been approved by MSDE and by Family League if you are in Baltimore City. we can also get some really great deals on group rates. So if you are an organization who is looking to do professional development for your staff during this time, I know a lot of grant programs are saying that that's something that they will fund during this period. So this is a great resource for that. Sarah has put the link for an upcoming webinar on April 15th at noon into the chat. So we would love to see you there, and we can give you some more information about exactly what types of programs there are and pricing and all that stuff.
That's right.
And just one more thing before we switch over, sorry, just to add, here's some more information about the Cypherworks. You can also get your CEUs like I talked about, and you can take the courses anywhere. You can use your phone, your computer, your iPad, all that good stuff. And there's what our price is right now, $40 per year for the individual. And you have about 2.5 more weeks for that deal. And then also just a quick mention about the Maryland Coalition for Community Schools. We are doing weekly posts and resource sharing on how community schools are adapting to COVID as well. So check that out at MD4CS. Thanks.
Awesome. Andy, we're going to stick around, ladies and gentlemen. If you have to hop off, we want to try to get through some of these additional questions, as well as allow folks to continue sharing in the chat box. We're not going to cut out right away. We did want to, again, hear from you all in the chat box, also around what additional topics would you like to hear about next? I know we had quite a bit of information that we attempted to share today, and you all saw our upcoming topics for April the 17th and April the 24th. But what are some additional topics that you'd like to hear about, as well as let's keep the conversation going in the chat box. We'll stick around till, let's say, 3:40 or so. We'll even call it 3:45. Like, who's counting? It's Friday. I don't got nowhere to go after this. Actually, I do have a meeting at 4. But we're going to stick around until 3:45 to, again, get some of these final questions answered, as well as to continue the sharing in the chat box, as well as, again, please answer the question to this poll. What topics would you like to hear about next? I know there's a bunch of folks that have to hop off. Feel free if you have to. Awesome. Thank you all so much.
I think the upcoming funding town hall is going to be really important. And I know that a lot of people are going to be looking forward to that information.
Awesome. Awesome. There's one question from Kathy. Dr. Bridges, I don't know if you're still on or if you want to address this. What is the best practice around background checks for e-mentors? I think that's an excellent question.
Background checks.
Is Dr. Bridges still on? I can also address.
Yeah, Sadiq, you can address that if you don't mind for me. I'll have to pull that information up here. I wanted to give us some specific information on it, and if you don't mind addressing it until I can pull it out of my slides.
Absolutely, absolutely. So according to the e-mentoring best practices, background checks in an e-mentoring setting are conducted in the exact same way, right? Via state, local, federal, the specifics of which depend on your program. There are some programs that only conduct background checks via state databases. We recommend that state and federal databases are utilized. And again, in the exact same way that we would require fingerprinting, again, locally at the state level and federally, we recommend that is the exact same process that an e-mentoring program would utilize. The only difference being is that in traditional e-mentoring programs, your mentors might be from all across the country, and your mentors rather might be from all across the country, as is the case for your mentees. So really just making sure that there is a standard process across the organization is key in the event that there are multiple jurisdictions that have to be addressed from a background check standpoint. But absolutely though, the bottom line is that background checks still need to happen in an e-mentoring setting. And I think the other piece is, which your question also brings to mind, Kathy, is we should also all be sort of in recruitment mode as well. You know, for a lot of the programs and partners that we've spoken with, folks have had this question, like, should I be recruiting right now? And for me, the answer is absolutely yes. Like, our young people, and I think Reginald spoke about it, Dr. Bridget spoke about it, our young people are in a vulnerable state right now. And having more supports right now is absolutely more desired than less supports right now, given the fact that a lot of our young people that saw school, physical school, as a solace, in many cases don't have that anymore. So I think we need more support right now.
And just to add to that, Sadiq, I also had some information on the screening where it says other screening recommendations to note include examining prospective mentors and public social media accounts to see how they communicate online and assess likelihood of them sharing inappropriate exchanges with their mentees. So just the screening process as well is very important, besides the background checks, just to see how, if you look at the social media and how other participants communicate prior or in their past, you can kind of get a understanding of, or maybe just a snapshot of how they may actually communicate with the mentor. So if there is some negative stuff going on, that you can kind of identify that in the early stages and then make some changes.
That's a great call. Almost like a sniff test, right? Or a sniff test or an eye test, right? So right away, their social media is inappropriate. Might not make a great mentor. Great call.
And that's exactly like that digital footprint that Mr. Corbett was talking about during his presentation as well.
That's right.
One thing we have in the chat here from Nicole is about how about doing a webinar on ways that we can continue to reach youth when we are no longer being able to interact with them directly. And I just want to highlight a couple of things that we've been hearing and seeing. We've seen, you know, a lot of Zoom, a lot of webinars and things like that, but a lot of just like old-fashioned telephone calls, reaching out, making a call, using apps. I know that some teachers and staff have put together caravans to drive around their school neighborhoods to honk and just to say hello and let their student know that they're still there and that they still want to be with them and want to interact with them. So just a lot of creativity to let these people know that we're still thinking of them.
That's right. And to Nicole's point as well, we will address some of those creative ways to engage with young people on our next webinar, or should I say our webinar in 2 weeks on April the 24th. So again, next week, we're talking all about funding for our nonprofit organization partners, right? Youth development partners. And then the following Friday on the 24th, we'll be talking about, again, just creative ways for us to engage during this time frame. Awesome, awesome. So we might not need to hang out till 3:45. Any, again, additional questions, comments? What would you like to see in our upcoming webinars? And again, please share out those additional resources. Make sure that you email Sada if you would like a certificate of attendance or participation. Ways for organizations to collaborate. Great call. Great call. Thank you, Emily.
I think we might get some of that on the next webinar about funding. A lot of the philanthropies and funders are definitely looking for all of us organizations to work collaboratively so that we can cut down on costs, cut down on overhead, cut down on repetition, and really serve our youth. So make sure you stay tuned for that next week.
Again, Sada, if you do need a certificate of attendance for today, Sada just typed her email address. Please email her directly and we'll make sure you get our best certificate of attendance. Additional webinar could be ways for helping parents navigate online from an education standpoint, like how to turn into the teacher, which, man, it's been a learning experience for me and my wife. Wowee. Wowee. I was not ready. It was a Kevin Hart voice, right? I wasn't ready. I wasn't ready. We weren't ready. It's been very scary, very scary. I'm just like, man, he's never going back to school again. And my wife is like, go sit down. That's pretty much how that conversation has gone. Final questions, comments before we wrap up. Thank you all so much for being here. Sharon, yes. Different organizations sharing their programming. Ladies and gentlemen, you registered for this, so please stay tuned. Check your email. We will be sending out, again, a recording, slides, and the chat transcript of what was typed in the chat box from today's conversation. Peace and blessings to you all. Happy Friday. We'll be in touch with you all soon. Thank you so much.
Thanks, everyone.